Hello, this is a video on the anatomy of the pelvis and the hip. The pelvis is the base for the trunk and the girdle for attachment of the lower limbs. The pelvis is comprised of two hip bones, the sacrum and the coccyx. The pelvic girdle is comprised of two hip bones. The ilium forms 2/5 of the acetabulum superiorly. The ischium forms 2/5 of the acetabulum posteriorly, and then the pubis forms 1/5 of the acetabulum anteriorly. The acetabulum, which is the cup-shaped process, is going to articulate with the head of the femur, and the three bones are separated by cartilage in children but become fused into one in the adult. We have two columns used to identify fractures around the acetabulum. There's the iliopubic column, which is the column between the ilium, which is the part that's up here, and then the pubic bone, the lower portion, as well as the ilioischial column, which is the ilium, and then also consists of the ischium. That's called the ilioischial column. So looking at the different structures that we have, we start with the iliac crest at the very top, the iliac fossa, this is on the anterior aspect of the hip bone, the ASIS, anterior superior iliac spine, the AIIS, anterior inferior iliac spine, the body of the ilium, the acetabulum, the body of the pubis, the ischium, the obturator foramen, the ischial-ramus. Now this down here is referred to as the inferior pubic ramus technically because this is the pubic bone, and the superior ramus is technically the superior pubic ramus. The spine of the ischium, the posterior inferior iliac spine, the posterior superior iliac spine, the auricular surface, which is going to articulate with the sacrum, and then finally the ilium. Posteriorly, we have the iliac crest again, the posterior superior iliac spine, the posterior inferior iliac spine, shown here, the greater sciatic notch, the body of the ischium, the ischial spine, a different viewpoint of it, the inferior iliac spine, the ischium and the ischial tuberosity, the ischial ramus, the inferior pubic ramus, the pubis, the obturator foramen, which is that hole here, formed by the ischium and the pubic bone, the superior pubic ramus, the body of the pubic bone, the acetabulum, the body of the ilium, and then we have the AIIC and the ASIS, the ASIS. The ilium has the ala. The ala is the body of the ilium that is curved. The ala has three borders, anterior, posterior, and superior. The superior border extends from the ASIS to the posterior superior iliac spine and includes the iliac crest. We have four prominent projections, which we've already talked about, the ASIS, the anterior inferior iliac spine, the posterior superior iliac spine, and then the posterior inferior iliac spine. The auriculate line forms the circumference of the pelvic brim, and that's the area that's going to be the line that's the squiggly line right here. The auricular surface is that surface that's going to articulate with the sacrum. The greater sciatic notch is also part of the ilium, and so it is the part that's inferior to the posterior inferior iliac spine. And then we have the pubis. The pubis is the smallest part of the hip bone. We have the body of the pubis, which forms 1/5 of the acetabulum anteriorly. The superior pubic ramus, which is the portion that's up here, It's going to project inferiorly and medially from the acetabulum to the midline of the body. We also have the inferior pubic ramus, which is right down below there. It's going to run from the pubic symphysis to the ischial ramus. And then we have the pubic symphysis, which is going to join the midline between the two pubic bones. The ischium is the part of the body the part of the hip bone that's going to be posterior, and it's going to form 2/5 of the acetabulum posteriorly. It projects posteriorly and inferiorly from the acetabulum to form the ischial tuberosity. The ischial tuberosity is the expanded portion in which the trunk rests when seated. We've got the ischial spine, which is the portion that's located in the superior posterior part of the body. And then the sciatic notch, the lesser sciatic notch specifically, is part of the ischium. We also have the ischial ramus. So the ischial ramus is down over here, and it projects anteriorly and medially from the tuberosity to its junction with the inferior ramus of the pubis. The obturator foramen, that's a large opening formed by the rami of the ischium and the pubic bone. Now the proximal femur has the head, which is the smooth, rounded region that articulates with the acetabulum. It projects medially. The neck is the part that's in green in all the pictures. It's a pyramid-shaped area that connects with the head to the body and projects medially, superiorly, and anteriorly from the body. The part that's in purple is the greater trochanter. The greater trochanter is the large prominent process on the superolateral portion of the femoral body. And so here it is over here as well. The lesser trochanter is the part that's in red, and it is on the medial surface. It's a cone-shaped process on the posterior medial part of the femoral body. The intratracheic line, that's a line that's on the anterior surface of the, here it is right here, of the anterior surface of the femur, of the proximal femur. It's located between the two trochanters. So it is a line, it's a less prominent ridge, where the intratracheic crest is in the posterior aspect, and it is more prominent. And it's between the trochanters again. The fovea capitis is a small depression at the center of the head that's going to connect the ligamentum capitis femoris. And so here's just images showing it, and here's the radiographic image of it. And then we have the shaft of the femur, which is the body. The femoral neck projects anteriorly from the body at an angle of 15 to 20 degrees, which is shown here. This one is showing the 20, but it's a 15 to 20 degree angle, and superiorly at an angle of 100 to 120 to 130, and they're showing 125 here, which is in between to the femoral axis. And then we've got the longitudinal plane of the femur is angled 10 degrees from vertical. So it's actually projected medially, going medially. The hip bone is the articulation between the femoral head and the acetabulum. That is a ball and socket joint. The second joint that we have is the pubic symphysis. That is articulation between the right and left pubic bones right in the center. We call that the pubic symphysis, and it's a symphysis joint, a cartilaginous joint specifically, but symphysis. And then the SI joint is going to articulate with each ilium, with the sacrum, and the SI, there's two of them. There's an right SI joint and a left SI joint. They join together at a 25 to 30 degree angle relative to the mid-sagittal plane, and that's classified as an irregular gliding joint. It is slightly movable, just like the symphysis joint is. Now comparing the male and the female pelvis, where the bony structure of the female is light versus the male is heavy. The shape of the pelvis is wide and shallow with the female, but is narrow and deep with the male. The superior aperture is called the brim or the inlet, and that's shown here in this picture as well as down here in this one, as well as here with the male versus the female. And notice that the female's pelvis is oval in shape where the brim of the male is round. On the inferior aperture, which is the lower portion between the pubic symphysis and the coccyx, it's very wide with the female and very narrow with the male. And then the coccyx is wider and curves more sharply posteriorly in the female. Image on the left is an image of a female patient versus the image on the right is that of a male patient. The pelvic cavity. So the pelvic cavity is the region between the inlet and the outlet. So this is called the pelvic cavity. It's also known as the true pelvis. There's nothing different between these two different, just two different terms that mean the same thing. But it's between the inlet and the outlet. Remember, the superior aperture is called the brim or the inlet. The inferior aperture is called the outlet. And so the superior aperture forms an angle of 60 degrees to the horizontal plane. The inferior aperture is measured from the tip of the coccyx to the inferior portion of the pubic symphysis. Now the greater pelvis or false pelvis is the winged area of the pelvis where it's a region above the brim. So this is the region that we're talking about here. And that's the part that we can see where the brim of the pelvis is, the ala, for example, that whole area. The lesser or the true pelvis is technically called the pelvic cavity. And that's where we've got the bony ilium and the pubis that forms the birth canal for the female. And it's the region below the brim. Localizing anatomic structures are important. So the iliac crest is at the level of about L4. We've got the ASIS, which it's going to be our location for our true AP projection of the pelvis. We're going to make sure that we have equal distance from the ASIS to the tabletop on each side for AP projections. The highest point of the greater trochanter is in approximately the same plane as the hip joint and also as the coccyx, so approximately the same plane. And then if you go a little bit lower to the prominent point of the greater trochanter, that's at the level of the pubic symphysis. And we're going to use that as our guideline. And then we have the ischial tuberosity as localizing anatomic structures as well. Now the dome of the acetabulum is formed by if you take a line between the ASIS, the ASIS, and the superior margin of the pubic symphysis, which we cannot palpate, we're going to go actually over from the greater trochanter to the midline, draw a line halfway between those two, and they'll get us to the dome of the acetabular cavity. We're going to have to drop 1.5 inches distal to that to get to the head of the femur, and 2.5 inches distal to that to get to the femoral neck. And here's just a picture showing that we would go from the distance between the ASIS and the pubic symphysis. That brings us to the midline between those two is about the acetabular dome. And we drop 1.5 inches to get to the femoral head and 2.5 inches total to get to the femoral neck. So a shortcut would be just to go over approximately 2 inches from the greater trochanter. Okay, this concludes our lesson on the anatomy of the hip and the pelvis. Have a great day.